This conference will now be recorded.
Okay, good morning everybody. I make that 9:30, so we're going to get started. I'm delighted to have with us Professor Sandeep Ranote, who's going to go through everything about mental health in the workplace. It is a very interactive session and we want you to ask questions, unmute yourself, throw out questions, use the chat box, which is the speech bubble in the top right hand corner of your screen. Feel free to chuck anything you want into there. And we've got half an hour with Sandeep. What I'd like to do first of all though is just give our usual disclaimer, which basically says the following presentation is produced for general guidance only and professional advice should always be sought before any transaction is undertaken. Individual circumstances can vary and therefore no responsibility can be accepted by Harts Limited or any of their affiliates for any action taken or any decision made to refrain from action by attendees of this presentation. Okay, what I'm going to do straight away is to stop sharing our screen and I'm going to start sharing Sandeep's screen. And we will hopefully, let's just stop that one and we will start sharing that one. And again, then it's going to be over to you, Sandeep.
Can you hear me, everybody? Good morning. Yeah, okay. Good morning. Really delighted to be here. Thank you, Stephen, for inviting me. And I think what's brilliant about this is it's great to have an international audience. So welcome to everybody around the world. And actually, that's quite an important point. And the importance of that is mental health and mental illness.
If someone, right, I will mute everybody. Just bear with me 1 second. Bear with me one moment. Mute all, right, and I will unmute you. Right, okay, away we go.
Okay, so that's not going to detract me, Stephen. Don't worry.
Yes.
It's testing me out there, but where I was the importance of a global community and a global audience is that mental health and mental illness, two different things. That's really important. We all have mental health we need to look after, but mental illness, like physical illness, can still happen. So how can we reduce that risk? How can we look after our own mental health, but also be ready and resourced as communities, societies, nations, and healthcare services and workplaces to meet the needs of those who actually become ill and have mental illness? It doesn't discriminate. Mental illness does not discriminate. And that's why, Stephen, it's wonderful to have a global audience, no matter where you are in the world, east, west, middle. We're a global community, and we now know through all the research, particularly I think advances in the last 25 years in mental health, that whatever socioeconomic class, whatever culture, whatever community, whatever group, cohort you belong to, mental illness can affect you. And I think that is the thread through any organisation and any workplace. As an employer, actually you are looking after human beings, all of whom are at risk of mental illness. So I think that's really, really important. So it's great. I didn't know there was a global audience, Stephen, but we had a strapline in the Department of Health a number of years ago that said there is no health without mental health. It is the foundation of all of our health and well-being. And I don't think there's ever been a more important time where that's resonated. And I do say that because of COVID, but not just because of COVID. The pressures on our society, on our young people and young adults particularly, was mounting and rising pre-COVID. What COVID has done has accelerated. And in some ways, I think a spotlight that needed to be shone on mental health and mental illness. So let's turn this into an opportunity, shall we? Also, just to say, Stephen, my title's changed like the NHS changes. So I am kind of still some of those things, but I think actually the point of this is behind every politician, professor, professional, parent, pupil, patient, we're people. And that's really important. So we are all people, and because of that, this is important, or should be important, to every single one of us. So next slide, please, Stephen. Now, apologies for those of you who are not from the UK, but I had to include this. This shows my age, I think, Stephen. But any prizes for those who can guess when this advert was out? It was a long, long time ago, and people probably, in your head, you might remember the song that goes with it. I'm not going to sing, Stephen, because I'm tone deaf. But Mars, a Mars a day helps you work, rest and play. Oh, Harry's answered, in the 80s. You're right, it was sometime about then. And this was a huge advert by Mars at the time. And the reason I include it is, although I'm not advocating that we need a Mars a day, it's more like I should be advocating an apple a day, but it's not that. I think I want you to all hold on to this concept of work, rest and play. So I think what's happened through COVID is overnight, many of us in terms of our workplaces became digital. Certainly in the NHS, Stephen and others, we would have taken 10 years to do what we did in a month, which is we converted the delivery of our care almost entirely during wave one, not 100%, but almost entirely into digital. That was unheard of. You know, doing anything in IT in the NHS was not clunky, it was just a mess, and it never worked. But we demonstrated that no matter which sector and which industry you were in, no matter which country you were in, that global community was made smaller, that workplace community was brought together, and we were able to do this. Great, brilliant, loads of advantages of that, not only from a carbon footprint to potentially productivity and efficiency, but actually hold that thought, what's it done to us? So there's the impact of COVID itself in terms of the virus, the illness, loss, bereavement, which I'll talk about in a moment. But actually, what's the impact of going overnight, literally, from interacting with peers, teams, going to getting up in the morning, having your shower, getting ready, going to work, being with a team, interacting with people, and then coming home, being with your family, and separating your day into the structure. We all say that kids need structure and routine. That's why school was so important to them in terms of timetables, routines, structure, very important. But actually, it's also important for us as adults and young adults in a workplace. We almost lost the division of work, rest and play. I don't think, hand on heart, even I will say this, I wasn't getting up in the morning and getting changed into my work clothes. You know, it was easier. It was grab a coffee, get on Teams, back to back, no, not even time to eat, go for a walk. And suddenly the digital workplace was very, very different. So I want you to hold on to the work, rest and play. Hugely important. Even the founder of Zoom has come out and done TED Talks on Zoom burnout and Zoom fatigue. So what is it that we can do as employers to combat that? It's not that it's bad, it's how do we make sure our employees can manage it and use it in a positive way. So next slide, Stephen. What I'm going to do now is concentrate on sharing with you data that I know I have and that is accurate, that will help you, which is about the medical profession and doctors. But the principles, actually, what we're finding is this isn't just happening in the workplace of the medical profession and doctors. This is actually, you can translate this into all of your organisations, whether you're from law, accountancy, finance backgrounds, businesses, wherever you are. Actually, remember what I said at the beginning, we're all human beings. So the principles of this, the reason I wanted to share this data is because it's hard data that is well established and it's really clear, and we've got some real outcomes from this to move forward. So it's about sharing those. And importantly, I'm going to share, in 2018, we had a big review of the literature so far around mental health and mental illness in the medical profession workplace. And we also had a British Medical Association survey conducted in 2019. Two very pivotal pieces of work, but they were pre-COVID. So I'm going to share with you what we knew pre-COVID and then what's happened during and post-COVID, which I think is really important to take some of those principles into your workplaces, because they will not be, they won't be very different. So next slide, Stephen, please. Thank you. So the British Medical Association, which is effectively our union, if you like, and is very, very long established, very robust, really strong union that very much looks at what it should be doing or what it isn't yet doing to support its medical profession. And the medical profession, of course, is very, very broad ranging and complex. So you have medical professionals who work in hospitals, in our NHS, you have medical professionals who work in private practice in their own businesses, small independent, from independent private practitioners to private practitioners who work in big organisations, either independent or working for other private organisations. Then, of course, you have GPs. We're quite unique in this country. So talking to our international colleagues, general practice, or what we refer to as primary care, doesn't actually exist in the way it exists in this country anywhere else in the world. And I do say that with pride, even though they are suffering huge consequences of COVID and workplace challenges at the moment. But they are our family doctors, if you like, very much embedded in the community and in their practices in the community, where communities reside, really, and that's your family doctors. And you have so many different specialties and doctors at different stages of their training as well. And I think that's important for you all to think about in the workplace. So not everyone's on the board, not everyone's a senior partner, not everyone's the owner of the business. You have employees at different levels. Many of you will have trainee employees. Many of you will now be employing apprentices. So I think that's also really important in thinking about how you look after every employee, because they are not going to have the same needs. So what did the BMA survey tell us? Some really key things. I'm not going to go through the whole slide, and Stephen, please do share these slides with people if they wish. They're not copyrighted or patented, but just reference me, if you do use them. So doctors are at high risk of burnout. Burnout is a concept. Go Google it and learn more about it, because that's another whole webinar in itself. But it's mental, physical, and emotional exhaustion. And what we tend to find early signs of burnout is actually employees are over engaged. They're doing more. They seem to be on speed, if you like, on amphetamines, and that can actually be quite dangerous. Are they burnt out? Do they have burnout? And that's a really important phenomenon that requires additional help or assessment. So we know that doctors are at high risk of burnout. Not a great thing, but what can we do about it? We know that doctors and medical students do suffer from a broad range of psychological and emotional conditions, more than the general population. We knew from this survey that doctors were self-coping, self-medicating with alcohol, particularly alcohol. Through COVID, we know that has risen and got worse in our general population by about a third, which is actually quite high. Those in the alcohol business reported boom sales throughout COVID like there has never been before. Now, although that might be a headline news in the Daily Mail, actually there's a real important, for us in the medical profession and healthcare profession, that was a really important warning sign. And when we looked at our A&E presentations, we had seen that presentations due to alcohol and or substances misuse had risen significantly by a third. Very important, because we can do things about that quickly. They are quick wins. Awareness of how to access support, actually, even in the medical profession, remains poor. Why? Because there's still huge amounts of stigma around mental health and mental illness, believe it or not. So that's another area that employers and employees and organisations can do lots about. Start having conversations. It's good to talk. And when you're role modelling that from the top of the organisation, that's really important. So what we call, we say from board to floor, that's really important. Another thing I think that was important from this survey was that the majority of doctors and our medical students, if they were going to seek help, they didn't want to do it within the workplace. They were seeking it secretly, privately, outside because of the stigma. And that's not okay. That's not good enough in terms of as us as an NHS employee, as an organisation. Next slide, please. Thank you. So the 2018 review of literature that I mentioned, I included this because there were 6 themes that are translatable, as I say, to all organisations. High presenteeism. This is a phenomenon where people still come to work even though they're actually not well. And they do that because they have a real sense of duty, that they mustn't let their colleagues down, they mustn't let their employers down, their organisation down. And so they're there, but they're not there. And that's really important in terms of, so how do you screen for that? How do you look out for that? These are the, some of the early warning signs are found in a lot of our wellbeing toolkits, which I'll come to. But also it's about regular supervision, regular line management, regular check-ins. Those are the kinds of things that you can do to check for this in terms of either from an HR perspective or in smaller organisations, just as seniors. So stigma and reluctance to help, I've mentioned that already. Workload and complexity of workload and environment. People don't pay enough attention to environment. And I think what COVID has done is really made us think about that. Remember I said about the work, rest and play, working in your homes. How many times have you been on Teams calls where the dog's barking in the background? You've got kids self-isolating from school or being homeschooled, coming into the room, and mums and dads getting really stressed about all of that. Many people don't have home offices. They're working in environments where they're sharing spaces. They're not small, they're not big spaces, they're small spaces, they're often cramped. Is the ventilation good enough? Is it lit well? Are your spaces set up so that people can take time out, can take breaks, can go for a walk, can go and sit in a pod and read a book for a while? The people who've got that right are Silicon Valley, are Google, are Facebook. We can learn a lot from them in terms of what they've done to transform their workplaces and their environment. We know there's a huge amount of literature around environment and the impact that has on human beings. It's simple to create art spaces and gallery spaces within your workplaces. It is not hard to do that. It's not hard to take out vending machines and have time-out spaces that have fruit and nuts and whatever, and books to read, or poetry, or poetry boards, motivational boards, and light spaces. It's not hard to actually create a little garden outside. Those are the kinds of things that we now know have huge impact on your employees. Don't underestimate it. And by the way, the NHS is probably the worst environment to work in. The buildings that have been around for 100 years, that have really poor Wi-Fi, for those of you who've been in waiting rooms, but we are acknowledging that more and more, and we are getting better, and we are transforming those spaces. We've even got art gallery trails, nature trails, walks, where promoting supervision and line management on a one-to-one to be done outside, on a walk, in a garden, in a park, rather than in an office. We're doing a lot more of that we never did 20 years ago when I first started training. It was horrendous environments that we had to work in, and that is really important. It can make a huge difference, particularly to going home with musculoskeletal and kind of fatigue symptoms. Bullying and harassment, and I don't think this is an unusual theme from particularly many large organisations. Was it yesterday I was reading Michelin star restaurants, the Kitchen Group, that's come out. How many headlines do we hear day on day, whether it's in Whitehall and Westminster, in political environments, to big blue chip companies and organisations, to our own NHS? Bullying and harassment still goes on, and it's one of the #1 reasons for employee mental health difficulties and mental illness. Really important to think about that. Fatigue, both fatigue from kind of burnout and stress, but change fatigue. We in the NHS, I think, one of our brilliant leaders said, the one constant in the NHS is change. We need to understand how to support employees to manage change better. So how do we think about that? Because we really are, I'm even fed up with change fatigue, and we've now got a white paper coming again, just after COVID. Well-timed, government. So I think it's also, about really thinking, if we are introducing change, your timing, when to do it and how to do it, and how to engage your employees in doing that so that they feel part of it, but it doesn't become another thing done unto them. Work-life balance, really important. I've been saying some of those things as I've gone along. We can move on. sorry, Stephen, I get in the zone and I start to want to share everything. COVID came. This is just a slide. As I say, we'll share it and you can have a further look. If you want to Google more, the Centre for Mental Health Research in the UK, for those of you internationally joining us, absolutely brilliant government think tank. And it doesn't just work and do commissioned work for the NHS. It's a government think tank that does a lot of commissioned work for all sorts of organisations, but it's around mental health. It's done a huge amount of modelling around COVID and what's COVID done to us as a population here and potentially in other countries. And it did a lot of modelling work and predictive work. So although it's for the whole of the UK, this is England data. It predicted last summer after wave 1 a huge mental health surge and super surge that would hit us in 2021. It has, and it is. So I talk about the pandemic after the pandemic being the mental health one. And I don't just say this for the UK. Our international colleagues, this is across the globe. The World Health Organization is making mental health its big priority. So please Google and access some of this kind of work as well as the WHO. It will give you lots of information to think about. Now, the problem with COVID, we've had other pandemics, but we've not ever had benchmarking data around mental health. H1N1 and SARS were two really important pandemics, but they never collected information on mental health, believe it or not. The Spanish flu in 1918 was the last global pandemic, but that was 1918. If we didn't collect mental health data in H1N1 and SARS, we certainly weren't collecting it in 1918. So actually, we didn't really know. And it's a new and novel virus. We're learning every day. We now know that in terms of long COVID, which is the syndrome that people are now, the off the press, this month's data, 1 million people in UK households are reporting, self-reporting symptoms that would fit long COVID. 1 million. That is a lot of people, and that's a lot of your employees. And we now know there are over 300, well, just under 300 symptoms that fit long COVID. So this is a complicated issue that we're dealing with. And over 50% of long COVID is mental health. So what did it tell us, though? We are now collecting all this data to inform the future. In England, we know that about 8.58 million adults are going to need additional mental health support. 2/3 already had mental health needs, but 1/3 brand new. In our NHS workforce, that's 200,000 people. You know, we're talking about 20% of our population may need additional mental health support, not just from long COVID, we're talking in its entirety. And we know about 40% of our doctors are reporting worse mental health. 60% of under 18s are reporting worse mental health. And some of you are under 18s are working, they're employed in workplaces. But it's not all bad. It's not all bad. Next slide, please, Stephen. What can we learn? Well, I think it was Marie Curie who said, we now have data. Data helps us to understand more so that we can fear less. And that's what we need to hold on to. We do have hope because we now have a lot of data over the last 12 months. What are we going to see? So the things that you're going to see most are anxiety disorder, depressive disorder, particularly anxiety, a mixture of the two, burnout and post-traumatic stress. Why? I've also mentioned long COVID, so I won't mention anything more than that. Why? Because of COVID itself, people have suffered with the virus, they've suffered loss because of having to be at home, lockdown and the restrictions that poses. Things that happen in family systems, for some people being at home is good. And for some, actually, it hasn't been good. We've also seen with alcohol rise, a rise in presentations due to domestic violence. Think about that. That's quite a hidden phenomenon. And employees do have a responsibility to think about that. We have a phenomenon called post-ICU syndrome of people that have witnessed or been through ICU. That's a phenomenon in itself. We still have yet to understand the economic pressures. And in 2008, when we had an economic recession, what we know is it took about 3 years to realise the real impact of mental health, mental illness, and particularly suicide. So suicide rates have not gone up yet, but it's a warning. We need to be ready and resourced. I hope they won't, but learning from past economic pressures? We still don't know, and that's really important. I just also want to say it's not all bad. What we also know and recognise, and we know this from military research, because we can compare this to kind of military, the military work, because it's akin to going through a war. We actually also know there's a phenomenon called post-traumatic growth as well as post-traumatic stress. So there's at least a quarter to a third of people who are reporting a sense of purpose, resilience and survival, and actually that there are good things that have come through COVID, and that their lives have been transformed, possibly philosophically, but also through changing what they do in terms of their businesses, but also what they do in terms of their work and how they work. So actually we need to harness that 25% of either our employees or our communities to understand how we can use post-traumatic growth in a positive way. Next slide, please, Stephen. I know we said it was interactive, and I am happy to take if people interrupt me. So, Stephen, if you do want to interrupt me, just please interrupt me. I think people will want to know, what do we recommend? What I have done is I've shared something with Stephen that we've put together in Greater Manchester. It's called the Greater Manchester Wellbeing Toolkit. It's absolutely phenomenal, Stephen. It requires another webinar, but it's not patented or copyrighted. You can share it with everybody. You can all use it. You need to have a kind of play around with it. It's a digital toolkit that provides you with all sorts of resources for your employees and yourselves, links, onward signposting, everything from what you can do to self-help and self-manage, so that's this kind of purple box, to what you as an employing organisation can do in terms of in the workplace, to also signposting when you know actually your employees need additional help. Don't try and do everything. Everyone thinks they're a mental health expert at the moment, which kind of bugs me, because that was 15 years of training and hard work. There's lots that we can do to keep well, in the same way that we keep our physical health well, in terms of reducing your risk of high blood pressure and diabetes, all the lifestyle factors, your diet, your nutrition, physical activity, etc. There are 5 ways to well-being. There's lots of things we can do around our own mental health and well-being, whether it's self, workplace, etc. But also when you need additional support and assessments and treatment, you do need it, and there is help out there. So there's
if anybody wants a copy of the link, just put your name in the chat box and I'll email a copy over to you.
Because there's loads in there that I think you'll find helpful. Next slide, Stephen. Just in again, these slides you can all use in terms of what next as a kind of employee space. This is the branches of a tree, firmly rooted together, but in order for a tree to blossom and grow, we need all these 8 branches, really. So this was done by our Academy of Medical Royal Colleges, but it was a kind of tips for the workplace. This is the kind of thing you can print out. You can put on a workspace digital board or a workspace breakout room, so that it's there visually for people to remind themselves, what do I need to do? What do I need to keep doing? Use legitimate sources, whether it's information about COVID or it's information about well-being. There's so much bad information out there as well on the internet. Make sure people are resting and sleeping. It sounds simple, but it's very, very challenging to do. Regular breaks. Hydration. Can't emphasize that enough. I'm very bad at doing that. How many people make sure they drink fluids during the day? During our digital world of last year, do we do that enough on Teams? Have your glasses of water, have your bottles of water. That's the kind of thing an employing organisation can make sure that they do and have readily available. Physical activity doesn't have to mean sport. It can mean dance, it can mean gardening, it can mean walking clubs. Those are the kinds of things you can promote and encourage at work, digitally or otherwise. Culture, connectivity. We know from research, people who engage in cultural activities have a reduction in stress. We know that, whether it's theatre, whether it's music, whether it's art galleries, whether it's book clubs. There's been a resurgence of book clubs. It's something that we call bibliotherapy. Easy to do digitally, easy to do in a workplace in a lunchtime. Once a month, get together, do a book club. We know that there's a lot of research to show that those are the kinds of things that reduce stress, but also increases connectivity. We also know that digital connectivity is important to keep people connected, but actually, big study done last year shows that face-to-face social interaction, social connectivity is one of the single biggest protective factors against adult depression. So think about that. How do we safely bring that back in a blended approach? It's okay not to be okay. Start talking from board to floor about mental health and mental illness and looking after our feelings, and unhelpful strategies, and lots of advice around that. Next slide. I think we're on the final slide, actually, Stephen. I'm going to skip over that because I kind of talked a lot of around this already. And what I would say also is, I've mentioned things like the Valent Groups shorts rounds. Google them. Some people will be aware. Valent is British, so I prefer it. Schwartz is American. Sorry for any American colleagues, but essentially they're very similar. Valent Groups were introduced here in the 1950s, very long established, lots and lots of research. Valint, Google it. And it was introduced actually for GPs and family medicine, family practice, but actually it's now used widely across health and social care and into other industries. And it's all about reflective practice, but it's about a safe space for employees, whether you're leaders in a board or you're on the ground floor. And it can be done weekly, monthly, bi-monthly, facilitated by trained individuals, but you can train the trainer. And it's a reflective space to acknowledge emotions and feelings during the workplace and workspace, whether that for us it's about clinical cases, patient interaction, but it's also about colleagues, interaction with colleagues, customers, clients, dilemmas that might have arisen, ways in which you've responded and reacted. And it's a structure around learning lessons, what you can do by observing other people, what you can do in terms of peer support, and looking through different lenses in terms of how to support people through that. So I think those are some of the things that workspaces and places can do, as well as environmental changes, and importantly, some of that line management supervision. But thinking about, what do other organisations do? Learn from others, collaborate, form learning sets, commission people like us to come in and talk to you. There's lots more that we can do together. It isn't all bad. It is real, and we need to talk about it. We need to acknowledge it. We acknowledge diabetes. We acknowledge broken arms and legs. We acknowledge cancer, even though that can be really difficult. So we need to acknowledge mental illness and mental health. It is as important, if not more. And actually, it has been difficult and tragic, COVID, for many, and it's been surreal. But I think what we need, I love this Japanese proverb, and I think it's about seeing things through different lenses. Through many tragedies, we can triumph. And I think that's what hope and positivity for the future needs to be.
Thank you very much indeed.
I'm all right for another 10 minutes. I've just had a message through.
Fine, brilliant. I think I found that absolutely fascinating. I don't know about everybody else. I've got one question so far from Ian. Sandeep, does the NHS have the resources and staff to deal with this increased demand for your mental health services?
The $1 million question. Okay, I guess the answer is, does the NHS have enough resources, full stop? And will it ever have enough resources? And so there's that. But I think for us, it has been made by people who are obnoxious and rude and challenging, like myself and lots of others like me across the country. It's been made our single biggest priority, is what I would say. So what I would say is I do look through the hope and positivity lens of the glass is half full. I don't think we'll ever have enough resources for at the moment in terms of our NHS, but what we have done is it's absolutely being acknowledged, embraced and recognised. So we have a huge amount of significant extra funding to address long COVID. We have made it really clear that we need to address the mental health elements of long COVID with dedicated resources, so we are getting that. And then secondly, the increased demand in terms of mental health, not because of long COVID, but just because of what's happened, is here. We are recognising it, and actually what we're saying is it's not the NHS alone that will need to address this. It is the whole ecosystem of our communities in our nation, which will include voluntary and community sector, businesses, private industry, schools, colleges. So actually, we're very much now, I think what we need to do is also say and be honest, we're not going to be able to do this all on our own, and nor should we, because there's a difference between mental health, mental illness. There's also a difference between needing to come to a hospital or to a specialist clinic, but also what's in primary care, what's our voluntary and community sector, a massive untapped resource that actually can respond to mental health and mental illness needs. So we're doing that much better, and we're thinking outside of the box, and I think together that will be how we will inevitably be able to meet that need. So it's not all bad, it will be a challenge, but I think those are the conversations that I think people like companies like yourself, Stephen, are actually helping us to connect. And I think that's what we need to do more of. Where are our forums and spaces to connect? The NHS, being a public sector service, often doesn't connect with brilliant people in business and private industry that could actually think about this in a different way.
I agree. I think it's useful for us to be able to, I know we've put some of our staff through some mental health training as well, and we've operated wellness sessions or mindfulness sessions for our staff during COVID. Obviously that stopped just before Easter, but it's something that everybody could look to do, and if anyone wants any recommendations for people, no doubt we can provide that as well. Has anybody else got anything they want to ask? Any questions? I know I've got a lot of people asking about the link, so I'll get that link sent over to you as well. And the link for the webinar will actually be up on our YouTube channel later on today. So if you go to YouTube, search for Harts Limited, with limited spelt in full, you'll be able to get a copy of the webinar along with all the slides there as well. Before we finish, has anybody else got anything they want to add? Sandeep, is there anything you wanted to add?
What I would say is the toolkit that we're going to share with you, we'd be happy to talk to organisations if they did want to commission either a short piece of consultation work to help you think about how to make a workplace wellbeing a priority objective, part of your strategy. We can work, I can certainly, on an independent or in a small team way, work with you for as a one-off, as a short piece of work, or we're very happy to do something digitally as a webinar to think through that wellbeing toolkit in a more detailed way. I would say make it whether you're a small organisation, an independent organisation, a large organisation, we absolutely need to make it one of your priority objectives within your strategies.
Yeah, I would agree with you 100%. Anybody else got any other questions? I've got one question. How do we contact Sandeep? Are you happy for me to give your email address out?
Yes, Stephen. Contact me for what? Just
for one-to-one sessions advising other companies.
Oh.
So,
yes,
okay.
Yes, Stephen, that's fine. And I think you're going to share the toolkit anyway, aren't you? You're going to do that.
Yeah, we'll share the toolkit for those that have asked for it as well. That's no problem at all. Great. There's no further questions, so I just want to thank you again, Sandeep. It's been absolutely phenomenal. It's been fascinating, I have to say. So delighted to have you here. Well, it seems a shame to us to finish on having a government support update, but it's something I wanted to get done before Sandeep, after Sandeep finished, because I know she had to get off. But very, very briefly, the final self-employed grant is due at the end of the month for those that it applies to. Bear in mind that the furlough contribution, you're now having to make contributions to furlough. So it's 10% from July the 20th, from the beginning of this month, and 20% from the 1st of August. So the maximum you can get is 70% and not 80%. And bear in mind, again, the Companies House filing deadline is no longer 12 months, it's now 9 months. So bear that in mind as well. Thank you very much indeed for joining us. We're going to take a break now in our webinars until September. But in the meantime, we have recorded a number of short videos, so those will be going out gradually over the next couple of months as well. So watch out for those. Those will be going up on our on our YouTube channel and other places. But again, thank you very much indeed for joining us over the last few months, and certainly since we started doing the webinars. To everybody, have a great day. Thank you.